E by E prime ratio is an important Doppler measurement useful in the assessment of left ventricular diastolic dysfunction. Prime measured from medial mitral annulus by tissue Doppler is demonstrated here. Previously measured mitral E velocity is used to calculate the E by E prime ratio by the application. E by E prime is measured using a combination of mitral flow Doppler and tissue Doppler of the mitral annulus. It is an important measure of left ventricular diastolic function. Mitral flow varies both with left atrial pressure and the left ventricular relaxation time constant, which is known as tau. E prime measured by tissue Doppler is the movement of the mitral annulus during early diastole. It is inversely proportional to tau. E by E prime will be directly proportional to the left atrial pressure. Hence, this value is a good indicator of left ventricular filling pressure. E by E prime ratio above 15 is taken as an indicator of left ventricular diastolic dysfunction. In the case demonstrated, it is well above that, being 34.46. A value below 8 can be considered as a normal value, and intermediate values will be in the gray zone. E by E prime is useful in the setting of atrial fibrillation, where E by A ratio, which is usually used for assessment of left ventricular diastolic function, is not applicable. Now, what are the downsides of E by E prime in assessing left ventricular diastolic function? It may not be an ideal measurement to indicate left ventricular filling pressures in decompensated patients with advanced systolic heart failure. Difficulty has been noted in those with large left ventricular volumes and impaired cardiac indices, as well as in the presence of cardiac resynchronization therapy or biventricular pacing.